Okay, you're ready to begin.
Hi, everyone. Thank you for joining us on a Saturday afternoon. My name is Julie Parker, and I am helping with Montgomery County's COVID-19 communications response. And we wanted to come to you on this Mother's Day weekend to just share some thoughts that the county executive and our county health officer are having, given the news this week from the governor's office. While we're appreciative that we're starting to get some glimpses of what normalcy could look like, we recognize that in Montgomery County, we are in a different place than many parts of the rest of the state of Maryland. So we will begin without delay with County Executive Marc Elrich, and then followed right after that by Dr. Travis Gayles. Mr. County Executive, go ahead.
Yeah, so thank you all for coming out on this cold day. And I guess it's cold enough that people can't do the kind of activities the Governor Hogan announced this week. And we have some sobering news that we want to share with people. I've been talking with Angela Ossobrooks as well as with the other county executives in the state, and I saw the story related to Angela and Muriel Bowser yesterday on how they feel about the opening of things in this region, and I just wanted to share that we're in the same place as Prince George's County. We are not the western part of the state or parts of the Eastern Shore. We have a caseload which is still growing. We have the second highest number of cases in the state. Prince George's County has the first between the two of us. We have almost half the cases. We are a densely packed community, and when you think about it, the District of Columbia and ourselves in Prince George's County just overlap with each other. Our borders are completely fluid, and movement across borders is totally normal, totally easy, and it's important that whatever any one of us does, that all of us do. And until we're all ready to open, it is not prudent for any one of us to open. And that's been what's been driving our policy so far, and is going to continue to drive our policy. So we're looking forward to what the governor has to say next week, but I can assure you that until our health officer thinks that it's safe to open, we will not be opening some of these things. I'm like everybody else. Physical distancing and sheltering in place is hard. After a while, you just want to go out. You want to be able to sit on a bench and talk to somebody, go to a restaurant and sit down and eat. I go and I get carryout and I look at all those empty tables and I just wish I could just sit there and have my meal there and not go home and have to do dishes. But we're not ready for that yet. We need to base our opening on the facts. Otherwise, we're going to end up repeating this. And I'm, haunted by the story about Chicago, where the massive outbreaks in Chicago were apparently triggered by two social events. And it obviously doesn't take very many people to spread the disease, particularly when people don't know when they have the disease necessarily. And so you can be somebody who's spreading it when you're not even aware you're sick. And we also know there are lots of mild cases of COVID where people don't even realize they have COVID. They think they have a regular cold. And in those kind of circumstances, we need to know that the viral cases are down and that they're under control. We need to know that we've got contact tracing, which we're going to take to the next level, where the contact tracing will be accompanied by contact testing, so that if we find a tested person along that path that is positive, we can immediately follow out their contacts. So there isn't a time delay between when we talk to somebody and when they may actually become symptomatic, because in that in-between time, they could easily be spreading the virus. We are in the position to scale up our testing. We are contracting with additional sources of testing, and it's not just buying kits, but we're buying entire packages where we will get the kits, and we have the process. We have the companies lined up to process the kits. So we are anxious to go forward and enhance our testing, and I think Dr. Gayles will talk more about what that idea is. But until we're there, we're not going to open everything, and we're going to be very, very careful about what we do. And I really hope people understand this. This is in all of our interests to make sure that we don't get a second wave, or that this wave doesn't take off again. We're putting a lot of resources and a lot of time, and a lot of you are enduring a lot of difficult things in order to get this thing under control, and we cannot stop now. It would be a huge mistake to let up and have this reawaken, and or that's not like it's asleep yet. Have it expand even further, um, and wind up in trouble again, more trouble than we're in right now. So I hope people bear with us. We will keep people up to date. We're doing daily briefings on this. Information is available. You can see this, what we're talking about in terms of increase in cases. And we just want to be sure that you're all safe before we do something else. And we want to make sure that, if Montgomery County is safe, we make the district in Prince George's County and Frederick County safer. And when they're safe, they make us safer. It's kind of like with the mask. Everything we do really helps protect the people around us. And it's true whether you're talking about a mask, and it's true whether you're talking about policies related to opening. We don't want someone to open a mall in Virginia and have a bunch of Maryland residents or district residents go to that mall and then wind up possibly bringing back more COVID virus back to our county, or to any county, or to the district. So it is important that we do what's appropriate given the medical circumstances we're in. And I'll stop there and let Dr. Gayles say a few words.
Good afternoon, everyone, and happy Saturday. I just want to add to the county executive's comments. We continue to use data, much like our colleagues in DC and Prince George's County and Northern Virginia counties, to guide our next steps. I want to share with you some of the types of measures that we are looking at in terms of indicators to determine if we have reached the point where we can safely start to reopen businesses and get back to some semblance of life pre-COVID-19. So one of the big pillars that the governor pointed out was that all of the reopening strategies are contingent upon increasing testing capacity. So naturally, as we test more people, we're likely to find more cases. But we also want to make sure that when we're looking at declining numbers of new cases, that is in the setting of testing more people. And as the county executive mentioned, we've crafted a fairly aggressive testing approach that we will be rolling out in the near future, and sharing more details about. As you know, we have created multiple alternative test sites for individuals to access through our vehicle emissions program, and several other sites throughout the county. Particularly of importance is 2 of those sites are located in and adjacent to the 3 zip codes that have had the highest number of cases as documented previously, 209, 02, 04, and 06. And we continue to expand our outreach efforts in those areas and increase testing opportunities, such as through our rapid response and ready responder team that's in partnership with the state, where we are connecting with families in their homes and providing testing and support to them in linkage to other services that they need in order to have healthy outcomes related to COVID-19. We continue to explore other partnerships that will enhance our ability to focus not only on those high volume zip codes, but other areas as we start to identify cases more quickly through our contact tracing efforts, and be able to link people as quickly as possible to testing. Now, in those efforts to scale up testing, again, as some of the other measures that we're looking at the decline in new cases in the setting of increased testing capacity. We're also looking at the test positivity rate. So test positivity means of all the tests we're testing, what percentage are coming back positive? Because yes, in many ways, increasing testing and finding other people, particularly those who are asymptomatic cases that we would have missed otherwise due to previous testing algorithms. We also know that if that number continues to stay plateaued or increase, that could be concerning for other pockets of transmission. So again, that underscores why we are working to scale up our testing efforts and create testing opportunities for individuals who may have potentially been missed. Again, particularly those individuals who are asymptomatic who may be unknowingly spreading the virus because they don't realize they have it as they've not demonstrated any symptoms. So we're looking for the test positivity rate to come down. Right now, our numbers are at approximately 19 to 20%. And they've been steady for the last week. So we'll continue to look and see that number come down as a sign of optimism. We'll also look to see a decrease in hospitalization rate. About a month ago and several weeks ago, the hospitalization rate in Maryland for COVID-19 cases was approximately 26%. That number has steadily decreased and now sits at about 20 to 21%. And so we'll continue to need to see that number trend downward, because that suggests that even when we're testing cases and finding new cases, that the majority of those cases are actually folks who are experiencing a milder, less severe form of the disease, which also means that we'll be taking up less space within our hospitals, and patients will require less critical care and intensive care services. We'll also continue to look at decreasing fatality rates. And another measure that is important when we're talking about testing capacity, the governor's office has said that we'd like to test 2% of the Maryland population, and that's an important measure. We currently, based upon results earlier this past week, had numbers that suggested that we've tested approximately 2.3% of the Montgomery County population. And yes, while that is above the 2% benchmark set by the governor's team, we want to do even more. And so over the next week, we'll be rolling out more details about our aggressive testing strategy to expand on the work that we're already doing, and again, create new opportunities and access points for folks to get testing that need it the most. We share the angst and the anxiety with our peer jurisdictions in terms of reopening too quickly. And I can assure you, as the health officer of your county, that we will look at the facts and continue to look at the data very carefully and cautiously and thoughtfully, so that we can advise those processes based upon the numbers and keep you safe. I'll stop there, but happy to answer any of your questions.
Okay, and I just sent a message to the group. I see we have print, radio, and TV reporters with us for this news conference. If you're a member of the media, please type in your question to the chat box, and please indicate for us whether you'd like to speak with either the county executive or Dr. Gayles, or both, and that way we can sort of guide and moderate the conversation. Ike from Channel 5 is up first with a question for Dr. Gayles.
Hi, Dr. Gayles. How are you today?
Doing well, thank you.
All right, thanks a lot. Just wanted to go over something. I know you said Governor Hogan said he wanted to get that 2% threshold of testing every Marylander. You say right now we're at 2.3%, but you want to test more. When we're trying to figure out when things would start to progress on to the next level, meaning Montgomery County falling in line with what Governor Hogan wants for the rest of the state. I know there's a lot of things you're looking at: positivity rate, decreasing fatality rate, but when it comes to testing the overall Maryland's on a whole, is there a benchmark that you're looking to hit? I know 2% was that initial benchmark. Have we set another one, or is it just on an ongoing rate as much as we can?
I think 2% is the benchmark, but I think all of the jurisdictions recognize, are working hard to increase testing capacity so that we can test as many people as we can. I think part of that testing has to be, thinking about who do we test. So when we're saying increasing testing, so thinking about it, one of the groups that we want to prioritize in our efforts, at least in the first wave, is to test folks who are essential employees. Because during the last 2 months, when many people have been sheltering at place at home or being able to telework, there are lots of folks who've had to come out to work, and they've been in public. And so we want to create opportunities where we can test all of those folks as quickly as we can to ascertain how many of them, again, recognizing that typically if someone's had symptoms, they're going to stay at home and they're more likely to get a test. But we want to see how many people we could potentially pick up who have been asymptomatic, again, who are, because of their jobs and the nature of what they do, have to come out in public and interface with others. So that'll be one of our first priority areas, and that's consistent with a host of other jurisdictions across the country. because we think if we can identify as many of those cases, we can get folks isolated as quickly as we can and interrupt those potential transmission networks, which would again cut down on, we'd identify those quickly, but that would cut down on the number of future cases.
Okay, good. Ike? All right, any other questions from the media? And if so, either raise your hand and our moderator can see you, or just type it into the chat box. Darcy Spencer with Channel 4 is looking for, I guess, either one of you to comment. If we can open up Darcy's mic. Make sure she's labeled Darcy with Channel 4. Not everyone's Zoom name matches who they are.
Are you able to hear me yet?
Yes.
Yes.
Okay. Sorry about that. I usually host the meetings. I'm just curious, as far as the reopening, this could be to Elrich or Dr. Gayles. As far as what Hogan is doing and proposing and moving forward in the staged fashion, what are you opposed to doing at this point that he's saying that we're going to start doing? I mean, are we looking at you all disagreeing with what he's saying, let's open up these things, and you're saying, no, we're not going to do it? Is there that sort of thing going where you're going to reject things that the governor's saying is okay to do? I just want to make sure that I'm clear.
Yeah. So, I mean, at this point today, we haven't rejected anything. We didn't necessarily disagree, for example, with the golf, because in Montgomery County, the golf courses run by the county have said that they'll open it to only allow one person in a cart, and basically they want people walking. So you can maintain social distancing if you do it that way. Probably the one thing that I have trepidation about is the opening of parks for camping, just because, having been a younger person once and gone camping in parks, that is often occurs that people get together and camp, and they have a party in the park, and we've kind of said no more than 10 people together. That is frankly going to be harder to enforce if people go camping in the parks, and that could be problematic. I mean, it was that kind of thing that made a difference in Chicago, having a party and having more people exposed to it. And so I probably would have been more constrained about what I was doing on the parks. By and large, so far so good, I guess. Travis may have a different opinion, but we want to be sure that he understands, and I'm not the only county executive sending this message, that we are going to look at our local conditions. And I understand he's under a lot of pressure from people in parts of the state with very low rates, very low cases, and it has a lot to do with population and the spread of people and the lack of density. What's right for them may not be right for us, and we have to retain the ability to have our local health officers give us guidance. And he's as much suggested that he didn't order a change in state policy for everybody. He opened up state things the state controls, and it made a comment to the effect that localities will be working with their local health officers. We just want to be clear, and I wanted to support County Executive Alsobrooks and Mayor Bowser, because we are part of a group that is, in some ways more greater population combination of anything else, in the county, this side of the river. And we want to make sure we're all on the same page.
Go ahead, Darcy's got a follow-up.
Yeah, I'm just making sure you can hear me. So just to follow up very quickly with that, you mentioned also Brooks, you mentioned Bowser, but the other big piece of this is Northern Virginia, where obviously Virginia is more aggressively moving forward with reopening. Obviously, we all border that area as well. What are your thoughts about that?
Either one of us?
Sure.
I'll jump in. I'll jump in briefly. Well, and as an extension to the county executive comments, the governor and the directives did say, there would be room for localities to have some discretion in terms of looking at their local situation before making some of those determinations. And so there's some things, like playgrounds, where we're a little nervous and hesitant to reopen at this point. We do recognize, again, to the county executive's earlier comment about quarantine fatigue, we recognize that opening up some activities does create opportunities for some. Not everyone has access to golf or tennis and things like that. And so what we have actually asked is, even in the setting of not opening up certain spaces, we've asked our departments to think through if there's some other strategies that we can implement to ensure that different spaces may be used safely, so that we can explore some ideas how we can open up other opportunities for the larger community to have some access to recreation. As it relates to the folks in Northern Virginia, I know that all of us in the National Capital Region, including us, DC and Northern Virginia, at least from the health officer's perspective, we've worked very closely over the last 2 months in making sure that we all are aware of what's going on in our respective jurisdictions, so that we can move together in terms of creating reopening plans or response plans, recognizing that we're all connected in some ways more so than we are to our respective, to other jurisdictions in our respective states. So I can say from the health perspective, we're working very carefully. I know that the health officers in Northern Virginia share our concerns, and hopefully I'm not speaking out of turn for them, but they share our concerns and those concerns expressed by our colleagues in Prince George's County as well as DC.
Mr. County Executive, did you have anything to add before we move on to WTO?
It would not be good for the governor to require Northern Virginia to open up things that could expose everybody to more infection, or effectively, think of it this way, creating an attractive nuisance. I mean, our folks have been bottled up, not able to go shopping and do normal things. Opening up a major mall in Northern Virginia would not be a good idea. Our folks have done without restaurants and bars for a long time now. Opening up restaurants and bars in Northern Virginia would not be a good idea. Not good for their residents. I mean, the story on Fairfax today is another case of increasing cases. So I will hope that Northam grants the same degree of latitude to their local jurisdictions that Hogan so far has indicated he will grant us. We need to make local decisions that are based on local conditions.
Thank you, sir. Dan with WTOP has a question for Dr. Gayles, I presume, about antibody testing.
Right. Dr. Gayles, you mentioned that you're trying to increase the percentage of the population that's getting tests. But I was hoping you could explain, because my question is really focused on if you have a sense of how many people in Montgomery County have already had the virus that didn't know they had the virus because they couldn't get a test when they were not feeling well, or they weren't feeling, badly enough to be allowed to have a test. So, so the question is, are you going to make these public-facing employees that you mentioned, the essential employees, have a testing schedule where they will be tested on a regular basis? And will the average person who may have been feeling sick in March have any opportunity to see if maybe they did have the virus a month ago and have recovered?
Thanks, Dan. Excellent set of questions and questions that we have considered and will be a part of the testing strategy that we will be rolling out moving forward. So 2 points that I want to highlight. So as you pointed out, in doing testing with front-facing staff, there is a component that you'll have to probably require in some way frequent retests, because if I test today and I test negative, I may go out tomorrow and come into contact with it and test positive later. So yes, we are thinking through that, and that will be a part of the plan that we roll out. We are thinking through very carefully what is the appropriate time period to do that, to make sure that we're able to capture exposures as they come up as best as we can. And to your second question about antibody testing, this is $1 million question for a lot of jurisdictions. I know that we, colleagues here in the state and across the region, as well as colleagues across the country, continue to have conversations about how to best utilize antibody testing. as well as questions about the technology. So we know that a lot of the instruments that have been announced, they did receive expedited review through FDA, and there have been some concerns in terms about the sensitivity and the specificity of the test, because we want to be assured of if we do utilize a platform that we have as little false negatives as we can, so that we don't give folks false negative and false positive, so we don't give, on one hand, a sense of false security that they may have had it, as well as making sure that we pick up those who do. And so I say all of that to say that we have been exploring a number of options. We've talked to a number of companies. We've been approached about participating in research studies that are looking at the efficacy of these different techniques. And so again, that's part of our portfolio. We're looking to not only move quickly to be able to provide access to such mechanisms and devices, we want to make sure that we're using the best tests though when we do that. So I say all that to say that, yes, questions that we've considered and are part of our testing plan moving forward.
Okay, are there any other reporter questions? It looks like Dan has a follow-up to that. Carmen, if you could unmute Dan.
Right. So you mentioned earlier, Dr. Gayles, that I'm just looking at my notes here. You mentioned that you want to see the decrease of hospitalization from 26%. It's now down to 20 or 21%. The test positivity rate has been somewhat steady, between 19 to 20% based on the numbers from the last week. Is there any math? Is there any way to extrapolate based on those numbers and the number of people in the county? What percentage of people may have already encountered the virus, that have not shown themselves to a physician in any way?
That's a tough one. We don't have enough data to make those conclusions, because part of the other challenge, so there's a couple challenges that, naturally folks at home say, well, why are the cases high in Montgomery, Prince George's, DC, and Fairfax County, for example? We're very densely populated counties. We do have a high amount of folks who live in, large buildings, apartment buildings, things like that. There is a high percentage of high congregate living situations where you have many family members in one household, where it makes it very challenging and difficult to do self-quarantining and isolating. And that can be a factor of increased transmission. And we also have a high percentage of folks who are considered to be frontline essential workers. So we've got a lot of people in our county based upon the types of industries we have, and that's why they live here, because it's close to those types of industries. So we have a lot of people who are still going out back and forth and working. So I say all of that to say that those factors make it challenging to be able to look at the models and extrapolate to get the number that you're mentioning. As always, we continue to use the data and try to figure out if we can approximate things. But ultimately, at the end of the day, if we can really get this increased testing capacity up, we can actually find those people and not rely on the models to tell us where they are.
All right, everyone. Well, thank you so much.
Can I add something to that?
Yeah.
So the other problem with the testing is that we're testing largely a referred population. Somebody for whom there was a concern about. That's way different than testing a random population. And that's what we need to get to the point of doing, is where we can start testing, for example, testing all of the food workers in the county, and the front-facing employees is a way different sample than testing people who've been referred to us for testing because they may be symptomatic or may have been exposed to somebody that they know of. And so the larger the base we get of people who aren't referred, but are just the general population, you're going to get, I think, a more realistic number of what to your goal of extrapolating. You want to extrapolate off a random base rather than extrapolate off a targeted base. The numbers are just better.
Well, thank you, Mr. County Executive and Dr. Gayles, and everyone for joining us this afternoon. We hope you have a happy Mother's Day and wear your masks.
I hope everybody has a happy Mother's Day.
Thank you all.
Thank you.